Hello everyone and welcome to AceOSCE's video for today. Thank you for joining me, Alicia, and in today's video we will be going through an OSCE demo case. Your download for today states that a patient is coming to you with a prescription. Do as you would in your regular practice. Letting you know that if a patient is coming in, make sure that you use easy to understand language with the patient, no medical jargon, and keep your empathy and sympathy skills out so the patient is able to understand you clearly and feel safe talking to you. Let's get started. Hello, my name is Tina. I'm the pharmacist on duty today. How could I help you? Hi, I'm David and I have a prescription to be filled today. Sure, David, please have a seat in a private and confidential area. Everything we talk about here is going to be private and confidential. So here I see that you have a prescription for something called Ramipril, David. Did the doctor explain to you what this was for? Yes, it was for my blood pressure. It seems to be high recently. Okay, I'll have a quick look at this. Have you taken this medication before? No, I haven't. Okay. Is it okay if we go through your profile together, David? I just want to make sure this is the right medication and the most appropriate option for you. Yes, for sure, we can go through our profile together. Okay. So guys, just letting you know, take consent from the patient to go through their profile, and you can either elicit all the information from the patient or go through their profile one by one together. I just prefer the latter method so we don't miss on any points and make sure that we ask them everything, including their lifestyle information as well. So David, here I see your profile. It says that your name is David Lee, your age is 55, a newly diagnosed hypertension or elevated blood pressure, no known drug allergies, and you take no other prescription medications on a regular basis. Is that correct? Yes. Okay, any other medical conditions, any drug allergies that I may have missed out? No. And you take no prescription medications, right? No, I don't. Any over-the-counters or herbals? No, I don't. Any smoking or alcohol consumption? Yes, I do. Can you please tell me how much? Well, I occasionally smoke and then I drink whenever I go out to the bar with my friends. Okay. And does your job require you to sit for long periods of time, or would you describe yourself as more of an active person? Well, I try to be as active as possible, but I do end up sitting in front of the computer most of the day. Okay. And do you remember what the blood pressure reading was when you saw the doctor? No, unfortunately, I don't. The doctor just said that it's been high for a few weeks. I've been trying to monitor it. Okay, that's okay. It's good that you've been monitoring it and you went to the doctor at the right time. I think I see that you were concerned about the side effects of this medication and wanted to know if this medication was necessary. Is that right? Yeah, I've never taken medication before. I'm not really sure if I really need this, and I'm really concerned about the side effects. Okay, David, I appreciate you coming in and checking in with me. It would take me a couple of minutes to go through my reference to make sure this is the right fit for you. Is that okay? Yeah, for sure. Thank you, David. So guys, letting you know that your reference could be anything from the CTC to the CPS to an external reference where they've given you a monograph of the Ramipril. So make sure that you're well versed with these books so you know where to find what, so it's easily available and easy for you to maneuver through. Keeping in mind that when you're counseling, make sure that the patient has prescription for the right product and it is the appropriate medication. Explain the purpose of the medication, explain some common side effects and some rare side effects and how to maneuver through them in case they do face them. Advise the patient to take the medication at the same time daily, counsel on monitoring the blood pressure, the importance of adherence to the medication, and of course mention non-drug measures as well. Answering any patient concern in a clear and empathetic manner is the key to success, especially in the OSCE. So let's get started. Whenever you're ready and you've gone through your reference correctly, make sure that you look up confidently to the patient and let's get started. Thank you for waiting there, David, and I have my answer for you. It seems like the Ramipril, which is a blood pressure lowering medication, is the right choice that the doctor has given for you. So I'd like to give you a little bit more information about this medication before I let you go. This medication is called Ramipril in the strength of 5 milligrams. These are usually found as capsules, and the doctor wants you to be taking 1 capsule every day. Now, it should be taken with a full glass of water, and it does tend to cause a little bit of dizziness, especially when you start with a new medication. So it's a good idea to take it closer to bedtime for the first few days until you get used to this side effect in case you face it, and then you can start taking it at any preferred time, usually in the morning. Some side effects that you may or may not experience with this medication could be dry cough or dizziness. It should go away with time. However, if these are persistent and bothersome, let us know and let your doctor know. They may be able to intervene and change it to a different, more suitable medication. Some rare side effects that you may experience with this is allergic symptoms such as swelling of the face or lips, especially if it causes labored breathing. You should stop taking the medication right away and seek immediate medical attention or call 911. Now, monitoring the blood pressure with this medication is also necessary. It does tend to take a few weeks to kick in, so keep taking the medication even if you don't start feeling better, and don't stop it in the middle. Keep monitoring your blood pressure, both the up and the down reading, and show your doctor whenever you're going to see him next, probably in a month, because the doctor has not given you refills. It is important to adhere to this medication because that is going to give you optimal outcome of this medication. Some non-drug measures that I like to specifically tell you about are having a good diet, especially reduce your salt intake in case you're someone who takes more salt. That does tend to help with management of your blood pressure. And of course, exercising, going to the gym, reducing your smoking and alcohol consumption is also going to help manage your hypertension or blood pressure better. Now, you did ask me if it is important to take this medication, and I did already discuss some side effects with you. So I would suggest that you do take this medication. It is going to help you reduce your blood pressure and therefore other diseases that may be exacerbated by your high blood pressure. I hope I've answered your concern today. Have I? Yes. Thank you, David, for coming in, and I hope you have a good day. So guys, this was a full OSCE case demonstration where we went through the entire counseling of the medication and checked the appropriateness. This could be a drug, it could be a device, it could be anything at all. So make sure that you're fully prepared for your PEBC OSCEs and reach out to us for more PEBC OSCE practice. See you in the next one.